Hello to everybody. It is my great honor and a pleasure to present the EU project for innovative, active and healthy aging, City of Zagreb. The European Innovation Partnership on Active and Healthy Aging is an initiative launched by the European Commission to foster innovation and digital transformation in the field of active and healthy aging, and the City of Zagreb is a member of this reference site network since 2016. During 2019, it was re-accreditation of a reference site network. Just to know that Zagreb is the capital of Republic of Croatia and at the same time unit of regional administration and at county level, so it reserves powers and duties as both city and county. And our City of Zagreb reference site is formed as a coalition of four helix, it's called quadruple helix, consists of regional and national government and healthcare providers, some hospitals and also primary healthcare centers like ours, then academia and research, University of Zagreb, Libertas International University, Catholic University of Croatia, University of Rijeka, then civil society, Center for Promotion of European Standards in Healthcare, Croatian House of Heart, Coalition of Healthcare Associations, this is Patient Association, and also from IT sector, Ericsson Nikola Tesla, MCS company, and Zagreb Innovation Center. So we were awarded to have 3 stars reference sites since 2019. Healthcare Center Zagreb is primary healthcare center. It is the biggest primary healthcare center in Croatia. Provides healthcare for approximately 380,000 citizens on 64 locations. It has over 100 GP offices and also 66 specialist teams like pediatricians within primary care, then gynecologists, and also dental care services, but also radiology, laboratory, pharmacy, field nursing, and palliative care. Also have some counseling services like for nutrition and pharmacotherapy, and medical simulation center for training for medical staff. Last more than 5 years, we are mostly focused on E or M health projects and solutions. So we participate within 2 Horizon project, Health Status Monitor and M Health Hub, and also within Croatian projects like Health Diary and e-consultations, which is based to have this solution pharmacotherapy management through e-consultations and also detection on early familial hypercholesterolemia detection tool. So we managed to produce some of those e-health solutions collaborating within BFHA network, while we had twinning with Andalusia. So we realized that we also can make some solutions to enable our patients to have better care at home, particularly elderly patients. And these electronic monitoring solutions are important to alert physicians for prevention, screening, and early diagnosing. So some of those solutions we managed to implement are Patient Health Diary. The other one is HealthNet, so for patients to GP communication in real time, and also e-consultations for direct cross-specialty consultations from GP to specialists in hospitals. For example, these direct cross-specialty medical consultations, it really can save time and money. We could see that for example, in Spain, that over 20% of consultations when patients come to hospital are ineffective because patients forgets to have all laboratory reports with himself, and also some other reasons, and therefore when they started to implement these e-consultations or visits to specialist care are more effective and resulted in saving on time and money. For example, we calculated for our healthcare center according to number of our GPs and according to number of patients. If only 20% of consultations, which are now live consultations, patients going to the hospital services, if only 20% of those ineffective consultations would be e-consultations, it would result in over 100,000 less visits which are ineffective, and it would result in new approximately over 26,000 hours for specialists to deal with effective work. These are only savings for patients which belong to Healthcare Center Zagreb. So within this pilot work for e-consultations, we had 33 specialists actively involved, 4 hospitals in 16 medical areas, and exchange messages with approximately for 185 problems, and waiting time for these e-consultations was only 2 days. For example, for health diary, also project started 2017. This health diary is for measurement of blood pressure, health rate, glucose, consultation, and weight and height. And we involved over 7,800 patients and also 64 GPs, and received number of measurements was over 50,000. It was not really satisfactory number, but it was beginning. So we could see that there are lots of obstacles, and not only to produce good IT, good digital solutions for patients and also for medical staff for services. It's necessary to have commitment, investment, guidance, brand trust, also confidence to the solutions, interoperability among many hospitals, not only to one, and its solutions should be accessible to the patients and also to physicians. But these obstacles can be overcome, but really public engagement and healthcare stability or culture of long-term planning, it seems that these two are quite really important, because we couldn't overcome those two. And digital tools and ICT solutions are helpful in adherence to medical plans, improve quality of life and health outcomes of patients, and we could see really within this COVID experience. Our results show that there are many challenges across all levels and also across many sectors, policy, health organization, professionals, patients. These problems can be overcome, but they need to be acknowledged and addressed to have a good solution. And in conclusion, I would like to say that our action should be based on holistic approach, enhanced self-care and personalized care for better adequacy of treatment and increased adherence to safe and effective care plans. To have this well-directed public debate on this topic is needed, involving all stakeholders in the system, politicians, industry, social partners, users, scientific educational institutions, and experts from different fields of ICT application. It needs partnership, and also what is crucial, it is government decision and support. Thank you very much.